Taoiseach, this state is often described as a republic. And my understanding of the term republic is it's a state in which citizens have fundamental rights. And yet every single day we hear of citizens whose rights are being trampled upon. And who by? By the government. This week your target is the carers and those they look after. The respite care grant has been sliced by 1/5 for some 77,000 carers and their loved ones. So, Taoiseach, Ken Sice, Foblocht, Ata, Ogin and Shaw. You must know that this latest austerity cut, is going to cause real hardship, and go will Billa Crua Ella or Nadini Shin or Roig Strogoi Slash and Sale Hannah Fain. The citizens, these carers, save the state over €4 billion every year. They have no legal entitlements to a holiday, to a day off. And if you think about it, this doesn't even make economic sense, because your cuts could force some of these folks who are currently cared for at home into residential full-time care, and that will cost the state several times more than your savings. So, Taoiseach, even at this late stage, would the government change tack? And do you accept, if we really are a republic, that you have a responsibility to protect the living standards and the welfare of our most vulnerable citizens? So will you reverse this most unfair and unjust cut to the respite care grant, Taoiseach? Gordon Boggart.
Thank you, Deputy. Taoiseach.
Well, in respect of the services for older people, until 2011, Deputy, in the Republic that you speak of, there was no national approach at all to the procurement of home care providers to supply indirect services through the HCP scheme. Therefore, different standards, different approaches were being taken around the country in different locations, which left the HSE vulnerable to challenges, if you like, of anti-competitive behaviour and inefficient service. And most importantly, as Deputy Adams is aware, that left people in a very vulnerable position, as different practices had different standards applied to them throughout the country. In some areas of the country where there is no direct HSE provision for carers, where the HSE direct provision has not been sufficiently used, procuring services from what you call external providers was the only viable option to provide services for and support for older people who chose to remain at or to return to their homes. It was 392 million actually allocated in 2013 to provide those services for around 100,000 older people, or about 20% of the population over 65 receive some element of home care or day support service annually. And clearly there's an obvious need to provide high quality and services that are flexible to give the very best need to those people, such as the long-term residential care or the acute hospitals. The programme for government commits to developing and implementing national standards for home support services, because, as you know, people generally wish to be able to stay in their own home for as long as is possible before it becomes necessary to have them move to a longer stay institution. There will, however, be a need for primary legislation here, Deputy Adams, and for the introduction of a statutory regulation system that will apply across the board. In the meantime, the standardisation of services and the promotion of access and quality and safety is a matter of concern to the Minister. That means the procurement framework for home care service. It means national guidelines for the standardised implementation of the home care package system. And it also means, of course, dealing with the specific issue that you raised about respite care and the extent and the range of that. So also you need the provision of the new national health guidelines for the home health service, which includes elements of respite care, such as you mentioned. These are issues that are constantly under consideration by the Minister and will be reflected on in his budget estimate for 2014. Just for your information, the home care packages for 2013 are approximately 10,800. The new home care package for clients will be about 5,000. Home help hours are over 10.3 million. People in receipt of home help hours are 50,000 of them receive those. And daycare places 21,500, and people funded under the Nursing Home Support Scheme are 22,000. And then there are the new elder abuse referrals. They're about 2,500 as well, all being considered in the context of these services for this year.
Thank you, Deputy Adams.
Well, Taoiseach, I'm disappointed, but I'm not surprised by your answer. The question I put was very direct and very straightforward. There was no need for all of that fog that you created around it. The fact is, this is the first month that 77,000 citizens who look after loved ones in their homes will feel the effect of a cut which gives them 1/5 less than they had up until now. That's the reality. And what I asked you to do was to reverse that cut because it's unfair, but also because it's bad economics. If these people can't be cared for at home, if they end up in institutional care, it's going to cost the state even more. You talked about elderly people. Yes, of course, some of these people who are cared for, some of these loved ones are elderly people, but some are children. Some are young adults who have severe disabilities. And I think if you balance, you see, the government doesn't have a problem protecting big bankers. The government doesn't have a problem giving your own special advisors way over your own set ceiling for pay. And the government clearly doesn't have a problem taking money out of people who can least afford it. So, Taoiseach, just answer quite directly. Would you not consider, even now, even as this cut kicks in, reversing this? It will cost something like 26 million. That's what it will cost. So I would ask you, Taoiseach, very, very directly, to stand up and say, yes, we are trying to be a republic. We do look after citizens who need our help, and we will restore this cut.
Taoiseach.
Well, this is the implementation of last year's budget, Deputy Adams. The decision was to reduce the annual respite care grant by €325 from €1,700 to €1,375 for new and for existing recipients. The savings were to be 26.15 million in 2013, and the implementation date is June of this year. Nobody denies that this has not been an easy budget, an easy decision to make. But it was and has been a necessary step as part of our country's economic renewal. So while it's difficult, obviously, to have to implement these decisions, it's important to bear in mind that the carers allowance and the half-rate carers allowance was maintained. After the reduction, the grant is still considerably higher than it was back in 2006, before the economic crisis, when the rate was €1,200. And from 2002, that rate was €635 up to what it is today. The number of recipients in respite care grant increased from 75,000 in 2010 to over 80,000 last year. So carers who do give of their care and attention and their time and their love for their loved ones obviously receive significant income supports from the government, which are among the highest rates of income support of any country in Europe. The income disregard and the means test for carers is the most generous within the social protection system. A couple under 66, for instance, earning a joint annual income of up to €35,400 can qualify for maximum payment carers allowance, while such a couple earning €59,000 will still qualify for the minimum rate. These are high rates.
Thank you.
And carers will receive additional support, of course, in the form of free travel and the house benefits for those who live with the person for whom they care.
Thank you.
And the annual respite care grant in respect of each person for whom they care also. So if a person is getting qualifying social welfare payments and also providing full-time care and attention to another person, they can keep their main social welfare payment and get the half-rate carers allowance as well. And they can also receive, Deputy Adams, an extra half-rate carers allowance if they care for more than one person in the same house.